Okay, pancreatitis. So I'm hearing and seeing so much of this that it almost feels to me like an epidemic. And it's unfortunate because raw food gets a bad rap with this a lot. And the more likely causes of pancreatitis are things like grain based diets, toxic chemicals, drugs, rancid foods or cooked fats, stress and boredom, lack of sex hormones, or we go into the supportive remedies for spay and neuter, leaky gut, and unhealthy gut microbiota and enzymes. So for years, antibiotics were prescribed for pancreatitis, years and years and years and years and years, and they still do sometimes. But finally, veterinarians are following the human medical recommendations for this disease, and that is to give intravenous fluids and pain medication. And more often, and then supportive for me, some supportive holistic integrative products. So it really is the way to go, and not just throwing them on antibiotics, because then what happens if it is coming from something like the metabolites aren't being produced in the gut properly that produces the proper digestive enzymes that support the pancreas. Giving more antibiotics that are going to kill more of the friendly gut bacteria that actually produces those metabolites are going to be even less of a player to prevent pancreatitis than they were to begin with. So in our clinic, what we did was we would give intravenous fluids, arnica 1M or aconite 200C, and we would do them every half an hour, 3 times. Then we would be giving phosphorus 200C, iris 200C, and we would do them every 8 hours for up to 5 days. After 24 hours of being on IV and remedies, we would recommend that the pet parents give non-fat bone broth without onions. And if all is well, in 48 hours, they can introduce steamed or gently cooked whole foods, organic if possible, a balanced diet with enzymes. And then for animals that were on raw prior to that, I highly recommend cooking or steaming their food for a good 3 days, then slow, gradual introduction back to raw. And you can put like a tablespoon of raw in and do it really that gradually, so that if they go, oh, sorry, I'm still not ready for this, you've only introduced a very small amount, and you can quickly regain your momentum of the healing and just put them, just take that raw out. Don't be bullied into antibiotics. Be sure to talk to your holistic practitioner for support in this, because based on the blood work and based on everything, it's often not needed. Your vet will, for sure, in order to diagnose this, will recommend a blood test. And please make sure that you've asked them to do something called the CPL, which means a canine pancreatic lipase test. I've seen really many animals present with sore backs before any other symptoms appear. So be aware, because this can be an early sign. And this is where the CPL test is really helpful, because I used to do it routinely. If I got something in, even cats, then it's an FPL, even cats, if I had an animal in that was just overall feeling punky or over grooming, or maybe seemed a little hunched in their back, or they were just a little depressed or whatever, I would routinely do that test, because I can't tell you how many times animals have been diagnosed with something else when they'd had low level chronic pancreatic issues, and they just haven't got it bad enough to be in an acute, typical symptomatic state of showing pancreatitis. And it really can show up early in with all different ways. Like we even had a pug it was a French bulldog, and it came in screaming, and they were sure that it hurt it. We were sure that it did something to a disc, and we did an x-ray and the discs were fine. And I automatically was like, okay, this is interesting, because she had soft stool the day before. Anyways, we did an ultrasound and a CPL and some blood work, and sure enough, she had pancreatitis, acute, really, really acute pancreatitis. So just always make sure that everybody's checking off the boxes to be sure that it's not smoldering and underneath that.